Hello everyone, this is Dr. Nasser, and in this clip I would like to tell you about Hal-Jolly bodies, which are red blood cell inclusions. In this cell, you can see a round spherical dark purple inclusion. This is a Hal-Jolly body, and usually the presence of Hal-Jolly bodies indicates that there is a malfunction of spleen. Now, that can be due to autosplenectomy in diseases such as sickle cell anemia. Because of the vaso-occlusion, the spleen starts to atrophy and become hypoactive. Or you can see that in hemolytic diseases such as megaloblastic anemia or hemolytic anemias. In this smear, you can see some of these red blood cells are very large. Of course, there is anisocytosis. I would grade that at 2+. There are occasional abnormal red blood cell morphology that you may be able to observe. There's a spherocyte, there's a schistocyte, another spherocyte in here. There are target cells in here. There is polychromasia. But when you observe the Hal-Jolly bodies, basically the concept is this, that Hal-Jolly bodies, if they are present when the red blood cells is released from the bone marrow, they should be removed by the spleen. So if there is a problem with spleen function, then Hal-Jolly bodies number is going to rise in the peripheral blood, and you would be able to observe that on the smear. So it is important that you identify Hal-Jolly bodies accurately, and you doing that is very simple. Use your fine adjustment and focus up and down as I am doing now. And you can see a true Hal-Jolly body does not become reflectile and glassy. It does not become reflector and glassy. That is going to indicate that this is indeed a Hal-Jolly bodies and not an artifact or any other type of red blood cell inclusion. I would like to look at other fields and to see what else I'm going to be able to see in this smear. I do see the anisocytosis, I do see the polychromasia, occasional schistocytes, and here we go. We got another, looks like Hal-Jolly body. It is a red blood cell inclusion. It is a Hal-Jolly body. And as we go through the different fields, we would be able to observe occasional Hal-Jolly bodies. This is not a Hal-Jolly body. This is very likely a platelet that is located on top of red blood cell. I do see again polychromasia. I suspect this is the case of megaloblastic anemia because of those very large red blood cells. Those large red blood cells are commonly seen in a type of anemia that is known as megaloblastic anemia. And in here, what you observe in this smear, you do see a nucleated red blood cell in which the nucleus has been fragmented into two fragments. Basically, the composition of Hal-Jolly bodies is the same as these nuclear material. And you can see that how it is possible to have a smaller Hal-Jolly bodies surviving the release from the bone marrow and be seen in the circulation if the spleen is not functioning properly. Another confirmation that this is probably a case of megaloblastic anemia is the presence of this white blood cell that is hypersegmented. I do see one segment, 2, 3, 4, 5, and 6 segments in here, and this is referred to as hypersegmented neutrophil, which is also commonly seen in megaloblastic anemia. Again, the Hal-Jolly bodies are going to be round, spherical. Usually there is only one per cell, but occasionally you may be able to observe more than one inclusion inside of the red blood cell. My intention is to find another Hal-Jolly body for you, and show you the nature of this red blood cell inclusion, which is basically consists of the chromatin and nuclear material. This is an Hal Jolly body, and again is going to indicate a malfunction with the spleen.